I'm going to show you this slide here. This is the Washington group and their projections, and it shows that COVID is increasing pretty rapidly and could really explode globally in the next couple of months. One of the things that really modifies these curves is whether we continue to do masking, whether we continue to do sort of the physical distancing that we're asking people to do. There's a line here, which is the total number of ICU beds. If we continue on the current trajectory, somewhere around late January, we are going to have more patients than we have ICU beds. So the next few months, as many public health people have said, is going to be the most difficult period in public health in the last 100 years. The projections are really terrifying. And I want to give you what this could look like if we don't get our act together. So what does it look like when you overrun your healthcare system? What does it look like when there are so many people in the emergency department, the wait times go from hours to days? What does it look like when you've completely filled up your ICUs? If you completely fill up your ICUs, then you can't do surgery. You can't do elective surgery, and at some point you can't do any surgery. What does it look like when you're in a car accident and you get to the emergency department and you can't come in, or you get a stick in the eyeball? These minor things, which we could have fixed in a functional healthcare system, you no longer can do. And then people get really afraid to go to work, to go outside, because there's a healthcare system that doesn't exist. Dr. Laura Wen has been on the show, and she said there's this false dichotomy out there that you either have a public healthcare system that's really functioning well, or you have an economy, but that is a false dichotomy. You must have a functioning public healthcare system, or you won't have a healthcare system, and you won't have an economy. So to the non-clinicians out there, you ask, what can I do? And I tell you, you can do a lot for the healthcare clinicians that are watching tonight, and it's the basics. You just need to wash your hands. You need to do the physical distancing, and you need to wear a mask. Now, some of you are going to say that you've heard from the highest level of government that it doesn't work, that you shouldn't worry about it. Well, I'm going to say, tell me what you think about this. You're in the operating room, you or your son or your daughter or your loved one, and you're going to have an abdominal procedure. Maybe you're going to have your appendix out. Maybe you're going to deliver a baby via cesarean section, or maybe you've got a tumor. And the surgeon that day says, well, I'm not worried about getting sick from this patient, so I'm not going to wear my mask today. And the nurse says, okay, I'm not going to wear mine. And the tech says, I'm not going to wear mine. And the med student and the anesthesiologist. And for the next 2 hours, they perform that surgery on you. Your abdomen is open, and through normal conversation and normal breathing, droplets are spread. That's just what happens in our upper airway. And those droplets contain bacteria and they contain viruses, and they get shed and they're falling into this person's abdomen, this person that's you or your loved one or your friend. And then they close up the wound and it looks great. And 2 or 3 days later, though, there's a fever. And then there's an abscess. And then there's sepsis. Because the reason that those people in the operating room are wearing that mask is not because they're afraid of getting infected, but they're worried about infecting you. And if they did that, you'd probably consider that sort of malpractice, and you'd probably be right. You'd probably consider that to be immoral, and you'd probably be right. You might even consider that that act was criminal, and you'd probably be right. You know, every major religion and philosophical thought camp says basically in the end the same thing, that you should do unto others as you'd have them do unto you. That's what they all basically in the end say the same thing. You see, this virus spreads from person to person. And it's a problem because about 80% of the people with the virus don't even know they have it. And so you can spread it to the next person and the next person and the next person and them to the next person and them to the next person. And at some point, an old person will be in that line and they're going to get sick and they could die. An immune suppressed person is going to be in that and they could get sick and they can die. And even young and healthy people, for reasons that we don't understand, for genetics we don't understand, they can get ill and they can die. So think of that healthcare worker in the OR. That's you. You're not wearing the mask because you're worried about getting infected. You're wearing the mask so that you don't infect somebody else. So please wear the mask. Reduce your chance of spreading it to other people. Wearing a mask is not a political statement. It is simply one of the most cost-effective and easy things we can do to reduce the spread of this disease while we wait for vaccines and other therapeutics to come. It's a simple thing. It's the least you can do. Wear the effing mask, please.